North Carolina will begin its Medicaid expansion Friday under the Affordable Care Act. Medicaid expansion is a key provision of Obamacare, which expands health care coverage for the nation's and underinsured. Since the bill's passage in 2010, the number of uninsured people has been cut almost in half, from 45.7 million down to 26.4 million. And despite a dip in popularity after its initial passage, 59% of Americans now say they have a generally favorable view of the Affordable Care Act. Here to discuss the current health care landscape is Matt Fiedler. He's a senior fellow at the Brookings Institute and also worked on ACA implementation in the Obama White House. Matt, thanks for joining us. Let's start with Medicaid expansion. When the bill originally passed, only 26 states implemented that as a part of the law. Now 40 do. What role does that now play, all these years later, in American healthcare?
So there are around 19 million people that have Medicaid coverage under the ACA. And so, when we think about, some of the discussion about, where people get coverage today and how they would get coverage if the ACA were to go away, a big question is where would those people get coverage instead?
The legislative history of big bills like the Affordable Care Act is that after they're passed, there's a kind of tweaking of a bill that happens in Congress. But with the ACA, it's mostly the legislative action has a lot of times been just to try to kill it. So no bill is perfect. In its current incarnation, what from the ACA, if it could be modified by Congress, what would it need, or does it need anything?
So there have been a few different places where Congress has over the years considered changes. So one of those changes was actually implemented earlier in the Biden administration, expanding the subsidies that are available for people who buy coverage on the individual market. I think another change that was considered, it goes to the states that still haven't adopted the Medicaid expansion we were just talking about. There was a question of whether the federal government could step in and cover the people who would be covered under expansion directly. That ultimately did not become law, but I think it is one of the places where federal action going forward would be useful.
And briefly, Matt, as a factual question, those subsidies you mentioned, do those have to be reinitiated in 2026?
That's right. So the expanded subsidies that are currently in effect only remain in effect through 2025 and will need to be extended beyond that by Congress.
So we're in a presidential context. So that would be something that the president and the next Congress would have to weigh. And that leads me to my next question, which is that former President Trump, who's likely to be the Republican nominee, says he wants to work to repeal the Affordable Care Act. What would that mean?
So, the proposals that the president supported in the past, for example, in the annual budgets he submitted when he was president, generally repealed the ACA's main coverage program. So they repealed its expansion of Medicaid and its tax credits for people who buy coverage on their own. They also made cuts to the parts of the Medicaid program that predated the ACA. As a replacement, states would have received some funds from the federal government to pay for coverage, but much less funding than was available under the ACA. I mentioned earlier there are about 19 million people with coverage through Medicaid expansion, another 16 million enrolled through the ACA's health insurance marketplaces. So if those programs were to go away, those people would need to find other coverage. Some would, but others likely wouldn't, and we'd probably be talking about many millions of people becoming uninsured. The flip side is the federal government would spend less on healthcare because it would no longer be paying for as many people's coverage.
Though those costs would have to show up somewhere in the system. Final question, Matt, is we're in a presidential year. How do we think about what other questions should we be asking about the state of healthcare right now if we could force candidates to talk about or politicians to talk about the healthcare system and what needs to be addressed? Would you give us a question or two that we should be thinking about?
So one big item that may not get attention on the campaign trail, but is a big one, is the future of the Medicare program. This is the first year where more than half of Medicare beneficiaries have received their coverage through private Medicare Advantage plans rather than directly from the federal government. I think there are pluses and minuses around that from the perspective of the beneficiary. But we know that the federal government is spending a lot more on Medicare to cover people through private plans than it would if it covered them directly. And so what policymakers are going to do about that going forward is a big question.
Matt Fiedler, Senior Fellow at the Brookings Institution. Thank you very much, Matt.
Thanks for having me.